It's very common for someone to have knee pain. They go to their doctor and they get an x-ray or an MRI. Usually it's an x-ray, then an MRI, and they are diagnosed with knee osteoarthritis. And they are told your pain is due to osteoarthritis of the knee. So they now have this label of osteoarthritis of the knee. Then they get the treatments for knee osteoarthritis, right? Whether that's a steroid injection in the knee or a hyaluronic acid injection in the knee. Maybe in the future, if PRP is approved, a PRP injection in the knee or a knee replacement, whether that's partial or full. The problem is that this patient who has this diagnosis of knee osteoarthritis, their pain might not be coming from inside the joint. Their pain might not be coming from the cartilage, the meniscus, the subchondral bone. They might have pain from something outside the joint. So if you've got a pathological condition on imaging inside the joint, but your pain is out here outside the joint in a nerve, in a tendon, in a ligament, and all you do is pound treatments at this, it's going to do almost nothing for this. And so that's why I think a lot of the research is struggling to show a positive benefit in certain conditions with these therapies, because they're missing the point. You have to, they're not properly screening these patients for, having the pain generator be inside the knee joint, or figuring out what is going on outside the knee joint. That's why, like at our clinic, for example, every single patient, even though they have knee pain, every single knee pain patient to date has, for better or worse, they've had a different treatment. Because some people, their pain is coming from inside the knee joint and the fat pad and the infrapatellar branch of the saphenous nerve. The next patient might just be the medial collateral ligament. The next patient might be the coronary ligaments that attach the meniscus onto the tibial plateau. The next patient might be the cartilage, for sure. The next patient might be something completely different. Like everybody, even though they have knee pain and a diagnosis of knee osteoarthritis, their pain is made up of different structures. And that is where I wish the research would go. I wish the research would step back, do better diagnostic skills with physical exams, not so much imaging, and then apply these therapies, comparing steroids to PRP or PRP to physical therapy or whatever it is. That's where I wish the research would go.